Welcome to the Spine and Joint Institute at Redlands Community Hospital. Our patients' experience during their stay is a very important part of the healing and recovery process. Knowing what to expect before, during, and after your surgery will help eliminate any concerns you may have, so that way you and your coach may focus on making a full recovery. After checking into your surgery, you'll be moved into pre-op. Here you will prepare for your surgery by changing into your surgical gown and getting settled into your hospital bed. At this time, you will also be connected to any telemetry necessary to monitor your vital signs throughout the procedure. Once you're ready for your surgery, your surgeon and your anesthesiologist will meet with you to touch base before you are brought into the operating room to review the plan for your surgery. From pre-op to post-operative recovery, a nurse will monitor you at all times, making sure that you're comfortable and at ease. Depending on your specific procedure, anesthesia will begin as you transition into surgery and will be monitored for the duration of your procedure. The operating room itself will be bustling with activity as you arrive. You may see your surgical staff preparing for surgery. You may notice the temperature is slightly lower in the operating room, and the lights are positioned by the OR staff to help with your specific procedure. An occasional beep of a monitor is normal, since your vitals and your medications are all being monitored closely at all times. Remember, our staff is there to make sure that you're comfortable and prepared for your surgery. Feel free to ask them any questions during pre-op. Once your procedure is finished, you will be moved to the post-anesthesia care unit, a few doors down from the operating room. Here you will be monitored as the effects of the anesthesia resolve. You will begin to wake up during this time, and our staff will be on hand to make sure that you are doing well and that your pain is controlled after your surgery. Once you're comfortably awake, your coach may be invited in to visit with you before you're moved to the Spine and Joint Institute. Otherwise, they are encouraged to wait for you in your room at the Spine and Joint Institute. Upon arriving to your room at the Spine and Joint Institute, a nurse will meet with you to discuss your care plan and what to expect. As you settle into your room and you familiarize yourself with your surroundings, here are a few things to keep in mind. Medical equipment. Upon arrival to the unit, you will notice that there is quite a bit of equipment accompanying you. Foot pumps, IV lines, catheters, oxygen monitors, and the like are all a routine part of the surgery. As your stay progresses, these items will be disconnected as you recover. Alarms. Many of the monitors that are tracking your vitals are sensitive to movement. In the case that an alarm goes off, don't worry, your nurse will be along shortly to assess and deactivate any alarms. For your safety, it is best to let our staff turn off the alarms. Pain management. During your stay with us at the Spine and Joint Institute, our staff will be closely monitoring your pain. Each individual's pain management plan is unique and dynamic, and your pain rating will be checked frequently to make sure that you're comfortable during your healing process. Frequency of the staff. Providing excellent and attentive care during your stay with us is our priority, especially during the first 24 hours of your stay. The nursing staff will be checking in with you frequently to make sure that you're progressing well. Hourly rounding ensures your safety during the first day of recovery. You may be woken up to a brief assessment. This ensures your safe recovery from anesthesia. Every effort will be made to help you return to sleep after this assessment. Early ambulation. One of the key concepts of the Spine and Joint Institute is early ambulation. You may be surprised at how quickly patients progress during their stay with us. All of our patients begin supervised mobility within an hour of settling into their room and are up and out of bed the same day of surgery. Doing so shortens the length of recovery and begins building a foundation for successful healing. Thank you for choosing the Spine and Joint Institute at Redlands Community Hospital. Your experience with us is our top priority, If you have any questions, please feel free to contact your navigator.